My name is Michelle Dever, and I'm the president of the North Dakota School Nurse Organization. ND Snow wanted to put together an informational video for school staff to help you make an informed decision about whether or not you should receive the COVID-19 vaccine. Kylie Hall, the project manager at the NDSU Center for Immunization and Research, is going to answer some questions all of you may have about this new COVID-19 vaccine. So Kylie, tell us a little bit about your job at NDSU.
I am the project coordinator in the North Dakota State University Center for Immunization Research and Education. We also call our center CIRI. And I work closely with immunization stakeholders from around the region to improve immunization uptake in the state, and then also on different communication strategies around vaccines. So right now I'm working really closely with the Department of Health on communication materials related to COVID vaccine, and also helping with some of the educational efforts as we start rolling out this vaccine to people across the state.
How was the COVID-19 vaccine created so quickly in comparison to other vaccines?
So great question, great first question. I think the most important thing for people to understand when we talk about how the vaccine was developed so quickly, I think the most important thing to understand is what a typical vaccine development process looks like, and then compare and contrast that to what COVID vaccine development looked like. So the first thing to understand about clinical trials is that they typically take about 10 to 15 years to complete. Before the vaccine makes its way into humans, we do an exploratory and a preclinical phase. During the exploratory phase, this is when we have our lab scientists and our researchers in the lab looking for those vaccine candidates that we think will induce an immune response. Once we think we get a good candidate, we have a good candidate, then we move into animal models where we give the vaccine to animals and we see if they, one, elicit an immune response, but then two, if they're protected, if they're inoculated with the disease or with the virus. Most vaccine candidates do not make it past that preclinical phase. If they do, the sponsor or the vaccine manufacturer can submit what's called an investigational new drug application to the FDA, which talks about how they're going to test the vaccine in humans. If it's approved, it moves into phase 1 clinical trials. And in this phase, we're enrolling less than 100 people. It's very small groups looking at how safe is this vaccine when it's given to humans. If it passes phase 1, we move into phase 2, which will typically enroll a few hundred people. In this phase, we're really looking, again, at safety, but also looking at different dosage amounts. We're looking at scheduling. So if it's 2 doses, what happens if you give it 3 weeks apart versus 6 weeks apart? How does that impact the immune response? If things still look good after phase 2, then we move into phase 3, which is typically tens of thousands of people that are enrolled. We're still looking at safety. In the safety realm, we're looking for those rare adverse events that might follow vaccination to see if they occur in our study population. And then we're also starting now to look at efficacy. So how effective is the vaccine at preventing disease in people who got the vaccine versus people who get a placebo, which is typically just a saline injection. So if things look good after phase 3, then we move into submitting paperwork to the FDA for a biological licenses application, or a BLA. If the BLA is reviewed and approved, it typically takes months, if not more than a year. If that's approved, then the vaccine manufacturer will start making the vaccine in large quantities and start planning for distribution. In all, typically a vaccine timeline takes 10, maybe up to 15 years, depending on how long the phases take and how long some of that preclinical work takes. Now let's compare and contrast that to what Operation Warp Speed did. So in Operation Warp Speed, we were able to bypass a lot of the exploratory and preclinical work because we had done some of that work on other coronaviruses like SARS-1, or if you're familiar with MERS, which is Middle Eastern Respiratory Syndrome. We knew a lot about coronaviruses before SARS-CoV-2 came to the United States. So we had a head start, if you will, on a lot of that preclinical work. Other things that allowed us to move quickly, our clinical trials they still happened and we still enrolled large numbers of people, but some of those phases were able to be overlapped a little bit. So phase 1 overlapped slightly with part 2 or with phase 2, phase 2 overlapped slightly with phase 3. So we still did them, but they were able to overlap a little bit. Along that same lines, the FDA was reviewing clinical trial data as the clinical trials were progressing. Typically, they would wait until the end to review it. But because we're in a public health emergency, they said, we'll review it as the studies are going on. Also, probably one of the biggest time savers was we had a lot of infections occurring around the country. So very quickly, we were able to determine if the vaccines were effective. It's absolutely one of the downsides of this pandemic is that we have a lot of infections happening, but for a clinical trial, it was to our advantage because within 2 or 3 months, we were able to say these vaccines are effective and look how well they prevent disease. Another really big time saver is the manufacturing aspect. So the federal government, through Operation Warp Speed, funded vaccine development, but also vaccine manufacturing. So in a typical vaccine development process, the manufacturer would never start manufacturing millions of doses of vaccine before the FDA has said, yep, you're approved. That's a huge financial risk for the vaccine manufacturer to take on. The federal government said, we're going to take on that risk and start manufacturing these. So if they work, we have millions of doses ready to administer into arms within a few days. And so you saw that the Pfizer vaccine and the Moderna vaccine were being being manufactured during phase 3 clinical trials, which would typically never happen. But once those vaccines were approved, within a week, we were already giving them to people. So that manufacturing step really sped up our timeline significantly. And then lastly, I would say Operation Warp Speed has helped plan for some of the distribution logistics, and then also just helping procure supplies, things like needles and alcohol pads and different things that are needed to give the vaccines. They were able to get all of that stuff together, again, so that once the vaccines were approved, all of the supplies were also ready and the distribution was planned for. That is why Operation Warp Speed was able to speed up the vaccine development process. But the most important parts of clinical trials and vaccine safety, which is those clinical trials, they still happen. They were given to thousands of people, tens of thousands of people, and that's how we know that they're safe.
So basically, we were able to shave off years because one, the research had already been done. We didn't have to start over with that. 2, we were kind of overlapping some of those clinical trials. 3, we had lots of people to choose from because we had lots of infections. And 4, there wasn't a financial risk. So these manufacturers were able to start manufacturing right away, not worried that, well, if this doesn't pass FDA, we just wasted all this money and time making this. So that's how we were able to shave off so many years and why we have a COVID-19 vaccine so quickly.
So quickly, absolutely. Instead of 10 or 15 years, we were looking at about 10 months. The other thing I'll add, Michelle, is the type of vaccine this is, it's relying on knowing the genetic code of the virus. We're lucky that we live in 2020 and that we can decipher a viral genome very quickly. Had this virus come about in the 90s or even the early 2000s, we would not be in this situation today where we have a vaccine so quickly. So, not anticipating, but knowing the viral genome so quickly really helped us get this vaccine out and into clinical trials in a really quick turnaround.
That's exciting because I think in the future, vaccines in general it won't take as long. We'll be able to get them out quicker.
It definitely helps with pandemic preparedness in the future, yeah.
So you talked about the fact that a lot of people were tested, that the safety part of it and the numbers of people tested were not compromised during Operation Warp Speed. I've heard some staff say, I don't want to be one of the first people to get this. Should I wait until a few more people get it before I decide to get it?
Yeah, that's another good question. So if you look at the number of people that were enrolled in the clinical trials, in Moderna, it was roughly 30,000 people were enrolled, and Pfizer enrolled just under 44,000 people. So when given to tens of thousands of people, these vaccines showed that there was no serious adverse events associated with the vaccines, and also that generally people did fairly well. after vaccination. The biggest complaint would be just the side effects that come along with vaccination. Those are things like having a slight fever, maybe some body aches, chills, not uncommon to have joint aches, maybe even a headache. But those were generally really well tolerated, lasted 1 to 2 days, and then they go away on their own. We do encourage people if they're having some, a headache that's really severe, it's okay to take Tylenol or ibuprofen, but for the most part, people are going to be getting better on their own within a day or two. And one of the requirements of emergency use authorization for COVID vaccine was minimum clinical trial participant numbers. So Moderna and Pfizer both met that with their enrolled numbers. And then also the vaccines had to be 50% effective or more. And luckily, ours came out and they have 95% efficacy, which is above and beyond our wildest dreams. But the FDA set very rigorous standards for not only safety, but efficacy. And if you look at other vaccines that have been licensed in the last 20 years, very rarely did they have more than 30,000 clinical trial participants. A lot of times it's 20,000 or even less than that. So when we give them to large groups of people, we have more and more confidence that they are safe. And that's what we see when we look at the data for the COVID vaccines.
So you are not the first person receiving this vaccine if you sign up to get it now. Lots of other people have had it before you.
Correct. Lots of people have had the vaccine in clinical trials. You essentially take the number that were enrolled in the clinical trials, and then half got the vaccine, half got the placebo. So if you add up the 22,000 that got it in Pfizer, which is half of the 44,000 enrolled, plus the 15,000 from Moderna, you have about 37,000 that got it in clinical trials. And just today, when I looked, we have millions of doses that have been administered in the United States already. And again, we're not seeing any serious safety signals come about as we've been giving them to millions of people. So I'm very confident that they are safe and that our safety monitoring systems are going to work.
You had mentioned that these vaccines have a 95% efficacy rate. What does that mean?
Yeah, great question. So when we determine efficacy, it's a proportionate reduction in cases. And that sounds really technical. So when I say 95% efficacy, if you were to give the vaccine to 100 people and then expose all of them to an infectious amount of virus, 95% of them would be protected. If you expose 100 people who weren't vaccinated, you would expect all of them to become infected with that small inoculum of virus. And so it's a 95% reduction in cases, and that's where we see the protection in those people who are vaccinated. Almost everybody gets protected after 2 doses, but you do see some people who aren't protected after those 2 doses, and that's why it's important for everyone to get vaccinated to kind of build that herd immunity where we're all protected so the disease isn't transmitting in our community. It's also one of the reasons, until the virus is under control, that people are going to have to continue those mitigation measures, like wearing a mask, like social distancing, like washing your hands. Those things are all really, really important and will be until enough of our population is vaccinated.
So let's jump into that question. You had said even if you get the COVID-19 vaccine, you still have to follow the mitigation interventions that are in place, such as quarantining if you're a close contact, wearing a mask, all those good things. Why would I waste my time getting the vaccine if I still have to do those things? Isn't that what the vaccine's supposed to protect?
Yeah. So we know from clinical trial data that the vaccine prevents symptomatic disease. It also prevents severe disease. So it prevents things like getting really sick that you have to go to the hospital. But we need to continue doing these things because we're not really sure how well it prevents asymptomatic infection. And asymptomatic infections means you have the virus living inside of you, but you are not showing any outward signs. But that asymptomatic infection means that you could potentially spread it to somebody who isn't protected, who could suffer a really severe consequence from the disease. And so we're going to ask everybody to continue doing these things like mask wearing and hand washing and social distancing until we get more people vaccinated, until we know more about how well asymptomatic transmission is prevented with the vaccine. And we'll probably have some of that data by late spring or summer. So it's not like we're going to be doing this forever. but we need just more data to say with more confidence whether or not asymptomatic transmission is prevented. We don't want to make recommendations before we know.
So speaking of data, we don't have a lot of long-term data right now. How do I know that this is safe long-term?
Yeah, another great question. When you look at severe adverse events that are associated with vaccination and you look at past vaccines that we've licensed, we know that almost all adverse events associated with vaccination occur within 6 weeks of vaccination. We can link them back to that vaccine. And so when the FDA set up their safety standards for COVID-19 vaccines, they said your participants, 50% of your vaccinated participants have to have at least 2 months of safety data so that we can look back and say, are there any adverse events that could potentially be linked to vaccination? So there's at least 2 months of safety data on our vaccine participants. And we didn't see any serious adverse events that are associated with vaccination. And if they are there, if they were picked up in clinical trials, we know that they're extremely rare. So that 2-month safety window gives us really, really high confidence that these vaccines are safe. Now, I'll explain that, or I'll add on to that with, there might be a rare adverse event that's associated with this vaccine potentially that comes out once we give it to millions of people. It would be an adverse event that's 1 in 100,000, 1 in 500,000 doses, 1 in a million doses. That is possible. And we wouldn't probably pick those up in clinical trials when we only look at 30 or 44,000 people, but know how rare that adverse event is. And know what your real chances are if you get COVID. When we look at people who get COVID, 1 in every 152 people who are infected die. Think about that, 1 in every 152 people. And then when we start talking about a rare adverse event that might be associated with vaccination being 1 in a million, I mean, weigh the scales there, right? Take your chances and know that vaccination is the best choice, because we don't know how COVID is going to affect you, but we know if you get the vaccine, more than likely you are going to be just fine. And then there are those very rare side effects that a lot of times are manageable.
So basically, there's much less risk in getting the vaccination than getting COVID.
Yes, much less risk, much less risk. Yep.
So let's talk about the vaccines. How many vaccines were approved by the FDA? What choices do school staff have on the vaccine they receive?
Yep. So as of today, there are 2 COVID vaccines that are currently approved for use by the FDA. There's a Pfizer vaccine and there's a Moderna vaccine. People probably won't have the ability to choose between the 2 vaccines because vaccine supply is so limited. But at this point in time, know that the vaccines are very similar. They both use what's called an mRNA technology, and they're very similar in that they have similar efficacy. Pfizer is 95%, Moderna is 94.1%, so they're almost the same. They both require 2 doses, and they are both given in a 2-dose series where the doses are spaced apart. If you get Pfizer, they're spaced 3 weeks apart. If you get Moderna, they're spaced 4 weeks apart. But they're very similar vaccines. They work in the same way, similar safety profiles in that you may have some side effects that include things like fever, body aches, headaches. A lot of times those are going to be more prominent after your second dose. And I'm hearing that from a lot of my healthcare worker friends who have received their doses too. First dose, a lot of them are feeling okay, maybe a slight fever, but the second dose, just a little bit more side effects. But again, they go away on their own usually within a day or 2.
So those side effects that they are feeling, is that COVID? In other words, if they received their vaccine and they went and got tested, would they test positive for COVID?
Great question. So those side effects that you're feeling after vaccination are not COVID. The COVID vaccine cannot cause you to test positive for COVID, and it cannot cause disease because it doesn't have a live vaccine inside of it. Those side effects are signs that your immune system is working. Your immune system is recognizing the vaccine and it's making an immune response, similar to how you would feel after you get an illness. A lot of times illness is accompanied by fever and body aches. Those are signs that your immune system is working. So it's actually a good sign after vaccination if you have those symptoms, because it means your body has recognized the disease and is creating an immune response, which will hopefully lead to immunity for you.
So what if I've had COVID? What if I've already tested positive for COVID? Haven't I already built up those antibodies? Do I still need to get the vaccine?
We know that reinfection is possible, and So that is why we recommend that even if you've had COVID, that you still get vaccinated. There is a small caveat in that if you have had COVID in the last 90 days, you can defer vaccination until the end of those 90 days because reinfection is very unlikely within 3 months of you having disease. Otherwise, though, we would recommend that you get the vaccine at the time that it is offered to you, even if you've had COVID, because reinfection is possible. And we want to, continue to protect. We want to protect you, but we want to protect those around you and potentially transmitting it again to others in your community.
So because of that, does that mean that the COVID vaccine is something that I'm going to have to get every year, similar to like the flu vaccine?
We don't know the answer to that yet. And I think it's based on a couple of different things, right? It's how long does immunity last from the vaccine? We don't know the answer to that yet. So that's more to come. Potentially, we could also need more vaccines in the future if we see some significant mutations occur. Right now, the mutations that you're hearing about in the news are still going to be covered by the current vaccine. So rest assured that you are protected. But there is potential in the future that the strains could shift enough that we would need a newer or different vaccine. So right now, we don't know how often you'll need it. There is potential that you could need booster doses in the future, but we just don't know.
So you had mentioned that there's 2 doses with both Moderna and Pfizer. What happens if I get that first dose, but then I don't go get that second dose? Does it mean that it's null and void? It's no good? I have to start over? What happens?
We recommend that people get both doses, and that's because that second dose acts as a booster and we get more protection with that second dose. So there are a small number of people who won't become immune after 1 dose, but seeing it the second time gets us a larger chunk of the community that's immune. So that's why we'd recommend 2 doses. We do have very limited data on what happens if you only get 1 dose. And that's from clinical trials for people who either didn't receive the second dose or also, between dose 1 and dose 2, there is that 3-week period for Pfizer or 4 weeks for Moderna. And so we can look at, did anybody in the clinical trials get COVID during that short time period? And then were they in the vaccine group or the placebo group? We know with Pfizer, we think that there's about a 50% protection after 1 dose. With Moderna, it's about 80% after 1 dose, but we don't know how long that lasts. And again, it was just such a short time period, such small data points that we don't want to draw really any conclusions based off that. So I would recommend that everybody return for that second dose. And it's also important that you get the same brand when you return for that second dose. So if you got Pfizer the first time, you need to get Pfizer for your second dose. Similarly, if you get Moderna the first time, you need Moderna the second time. When you get your vaccine, you're going to get what's called the vaccination record card, and it will have your name on it, your date of birth, and then it will have which product you received. We would recommend that everybody keep that in a safe place, your wallet, center console of your car, wherever is the safest place. I would also recommend that people take a picture of their card on with their smartphone. You carry your smartphone with you everywhere. And in the chance that you lose your vaccine record card, you still have a picture of it and what product you received, so that when you return for that second dose, you know exactly which product you need and when you received it, so that the interval is correct.
Full disclosure, I did receive my first dose, and it was of the
Awesome.
Moderna vaccine. Yeah.
How are you feeling?
And
You feel okay?
it was great. I had a sore arm. I had no other symptoms.
Great.
Some of the other nurses in the group that received their vaccines about the same time, the ones who had a stronger immune response and felt maybe a little cruddier were ones who tested positive for COVID, which would make sense because their body is seeing it for the second time. They're going to have a little bit stronger immune response. So we'll see how the second dose goes.
Yeah, anecdotally, Michelle, that is what I've heard too. And it's essentially like, the disease was kind of like your first dose, first time seeing it, and
Right.
it's like
Right.
your booster. So maybe I've seen no formal data confirming that, but that is exactly what I've heard anecdotally too.
When I received my dose, it was so organized. While I was waiting, because after you receive your first dose, they're going to make you wait 15 minutes because they want to monitor for those adverse reactions. They gave me a QR code to scan, and I set up my appointment for the very next one. So before I even left, I had an appointment for my second dose. And you correct me if I'm wrong, but I understand that the state, if you receive whatever vaccine, whichever brand you get, they save that second one for you. So it doesn't happen where, they have all these doses, they vaccinate all these people, and then come the second dose, they don't have any. They're saving them, so you will have your second dose. They will not run out for you.
Yes, as of today. And I say that, and I say that I'm confident that there will be second doses with the way we're doing it. So how Operation Warp Speed was set up was to distribute first doses to states, and then saying the federal government are going to hold back second doses, and then we'll ship them out as people become due. So 3 weeks later, they'll get a Pfizer shipment, or 4 weeks later, they'll get a Moderna shipment. What has happened today, Secretary Azar had a press conference today, and they have announced that they're going to be releasing all doses that are sitting in storage to quicken how quickly we're able to vaccinate our most vulnerable populations. But we're doing that because we have confidence now in how quickly we're able to produce the vaccine. So we know that capacity is ramping up, and we anticipate that there's going to be supply. So there still will be a second dose for you in a couple weeks, but the logistics behind the scenes are going to look a little bit differently. But we anticipate and we recommend still that you get that second dose on schedule, and the federal government understands that that is still the priority, is to get 2 doses into people, not just 1.
How much will the COVID vaccine cost?
The COVID vaccine will be offered to people at no cost. Your healthcare provider can bill your insurance for an administration fee, but for those who don't have insurance or who can't afford that administration fee, they cannot be turned away. The vaccine should not cost people any money out of pocket.
Can I have the vaccine if I'm pregnant or breastfeeding?
Great question. Really great question. Right now, the vaccine is available for those who are pregnant or breastfeeding. We recommend that individuals talk to their healthcare provider about their current situation and determine if the vaccine is best for them. Things that pregnant women should consider when they're considering if they want the vaccine are things like, what kind of setting do you work in? Do you live in? Do you work in a high-risk setting, like healthcare, for example? Are you a teacher in a room with 25 other people throughout the day? Those are more high-risk situations than potentially somebody sitting in an office isolated all day. That would be things to consider. I would personally just recommend that you talk to your healthcare provider. For women who are currently breastfeeding, there are no formal studies on how the mRNA vaccine affects milk production, or if it could potentially cross into your milk supply. But right now, the vaccines, we have no data to suggest that they're not safe in pregnant or breastfeeding women. And the American College of Obstetricians and Gynecologists felt very strongly that vaccines should be offered to pregnant women because they are at a higher risk for severe disease from COVID. And so that's why they wanted them to be offered to women, and they can make that decision, in coordination with their healthcare provider.
So right now, both vaccines are not approved for kids less than 16, correct? Do we
Correct.
anticipate that will change and it will be available to kids, or are we just going to focus on vaccinating everybody 16 and older, hope for herd immunity, and go from there?
So the Pfizer vaccine is available for individuals 16 and older, and Moderna is 18 or older. Moderna and Pfizer have both announced that they're going to be enrolling children 12 and older in clinical trials for COVID vaccine. We anticipate that data will probably be available sometime in 2021. But right now, we don't have any formal data in children, and so we're not recommending it other than the Pfizer data for 16 and older. We do anticipate that at some point, clinical trials will continue to work their way down in age. So after they've done 12 and older, they'll incrementally work their way down. And I think as we learn more about how children transmit disease, are they reservoirs for disease, things like that, I think that will also help inform our recommendations. And so this is really just a more to come. Right now, we need to focus on vaccinating those who are most vulnerable and most likely to have severe outcomes from disease, which is people with underlying conditions, and then our older population.
I've heard that the COVID vaccine can cause sterility in women. Is this true? Should I be worried?
Great question. There was a myth circulating on social media that the head of Pfizer research said that the vaccine could potentially cause female infertility. And when we look into this claim further, we find that it is not true. And I don't think women should be concerned about infertility following COVID-19 vaccines. We have no data to suggest that there's any cross reactivity, like was mentioned in the social media post. Similarly, if there was any way that the vaccine could induce infertility, we would also see that from natural disease. So women that have had COVID would also be showing signs of infertility. And again, we're not seeing that anywhere either. We have animal models from the Moderna vaccine that showed that there were no concerns in animals that got the vaccine and then became pregnant. And so as of right now, I would just tell women the infertility myth is not true, and you can continue to vaccinate and still have children. I think when people truly look at COVID and what it has done to North Dakotans and what the unknowns are, and then you weigh the benefits of vaccination with the low risks of side effects, a really rare chance of anaphylaxis. Every time in my book, vaccination outweighs any of those potential risks, and it absolutely beats getting COVID. COVID has killed 1 in 600 North Dakotans. COVID has hospitalized about 1 in every 215 North Dakotans, and 1 in 8 have been infected. We don't know the long-term impacts of COVID. We see it impacting multiple systems in the body, from the heart to the lungs to the brain. And so when you truly weigh the risks of vaccination and getting disease, vaccination is your best bet. And so I would just encourage people, get your information from credible sources, do the work and truly think about, what is my risk of getting COVID in the next year. Without a vaccine, your risk is pretty good that you're going to get it. And if you've already had it, you could become reinfected. And then know that vaccination is the only way out of a pandemic. We have never achieved herd immunity for any disease in our lifetimes and in our human history without a vaccine. We didn't eradicate smallpox through natural infection. It was only once we had a vaccine. We eliminated measles from the United States with a vaccine. If we don't get a vaccine, if we don't take the vaccine, it will continue to roll through the population until enough people have got it where maybe we don't have exponential growth, but people will continue to get it. Loved ones will continue to become infected, be hospitalized. Our long-term care facilities will continue, to be locked down when there's outbreaks, and the vaccine is really the only way out of this, and it is a safe way out of this. We're lucky we have 2 vaccines that protect against disease, and so I would just encourage people to really weigh the risks and the benefits. And consider taking the vaccine when it's offered to you.
Thank you, Kylie, so much for sharing your knowledge and expertise. I hope that this gives school staff a place to go for more information so that you can make an educated choice on knowledge and facts and not myths and fears that we have seen out there. For more information, please check out North Dakota School Nurse Organization's website, ndsnow.com, or the North Dakota Department of Health website. They have an FAQ listed that has hundreds of questions that you can find your question and an answer. And if it's not there, please reach out to somebody and we will be able to get your answer to you.